Hello, my name is Konstantin Koshkin. I'm associate professor in Sechenov University, and I'm working in Digital Health Institute, and I will present the second part of our lectures in IT technologies and e-health course. And this lecture will be about digital transformation in healthcare. So let's start. Today we will talk about general concept of digital healthcare, about unified state information systems, how they are implemented in different countries, what are the main strategy for implementation of such a system, and I will present some examples in such a systems being implemented. First of all, let's say what we name under digital transformation. It's a process covering changes in management and in strategy, in data models, in operations, productions, and all other approaching. So it's not only implementation of some technological solution, but it's a change in processes, and it is a much more difficult process than just an IT tool implementation. And these processes are being presented all over the world, and mainly in developed countries, and the main points of these activities are electronic health records, so-called electronic health passports, personalization of medical services. So when we have all the personal data in the system, we can provide our services more targetedly and with better results. Of course, it's development of required infrastructure, so all the medical centers and other medical organizations will have all the necessary resources to provide these services in digital form. Of course, it's exchange of data about healthcare in digital form, and there is a lot of questions regarding how this data exchange should be done, and there are standards implemented to make it possible. So it's another very important topic. And it's impossible to create a healthcare information system without registries, directories, classifiers. So we will name the terms in the exact meaning without duplications, some small changes, and all the systems will talk on the same language if we'll try to simplify this problem. And of course, telemedical services are always on the table because there is a high demand for patients not to visit doctors by themselves and to receive this opportunity distantly to provide support. And these activities are quite similar. If we'll name regions, it will be just look like for United States, Canada, Europe, and there could be some deviations in amounts of funding for these programs. And of course, in other countries, similar programs are being implemented, and there are a lot of activities on the same direction in developing countries. So, why this topic is so important nowadays? There is a growing pressure on healthcare system as population became more aged, and there are chronic diseases which are appearing in this elderly category of patients. And there is a lot of demand for healthcare because our we'll call our patients here customers, will have expectations to receive a certain level of service in healthcare, and this request for such service will be elaborated from year to year. There is a process of globalization on healthcare market when patients can go to the different country to receive medical service with better quality as they are able to receive in their home region, and this also increase demand on medical services and data exchange processes, for example. Of course, there are opening opportunities for data automation processing, and for example, artificial intelligence solutions could elaborate on digital data in healthcare, providing additional support for decision making and to make some procedures even possible without involving humans. For example, some kind of pre-diagnostics running in mobile app or something like that. Also, there became available high-tech solutions for healthcare monitoring. For example, Internet of Things, so-called area of wearable devices, which could be used in patients to monitor the health levels or some activity levels, or from another approach, it could be some kind of mobile application interacting with the patient, and it will be Internet of Mobile Applications. And all this technology should work in the similar environment with doctors, healthcare professionals, and of course patients, and unification of information being gathered is highly demanded on this data exchange market. Of course, there are a lot of legislation in this area, and being compliant with all these legal entries are raising additional demand for technical solutions, because it's not a simple implementation of a soft piece of software, but it's a whole process of first of all we need to change legislation, then implement some standards, rules, and only after that we can develop some kind of software solution to change this process. I will show this on examples. Of course, all these activities are being carried out globally, and the World Health Organization help us here to harmonize all the activities, and recently a global strategy on digital healthcare were provided, and the grounding principles of the strategy are request for institutionalization of digital health on national level. So each country should develop some kind of strategy for digital health implementation and follow the strategy to implement all the required solution. And of course, there are additional requirements for available technologies for this process and for education of persons who will implement these technologies in practice. There are a very detailed guideline available how this should be done, and this process consists of several steps, starting with assessing of the current state and enabling environment for digital healthcare to be implemented in the country. Then establishing and sharing understanding and strategic plans with all stakeholders, covering all the required activities, and providing required steps to implement this. Next, we need to define the future state of the system. So it is literally what we need to achieve with implementation of these solutions. It's a vision of future background that we will work in. Then we need to plan and provide architecture for this system. And it's also need to cover available infrastructure, available entities, available stakeholders in the region, solutions to be implemented, current technologies, data exchange standards, and all these topics. Next, we will need to determine health content requirements, so it will be detailed information of health data that we will process in our healthcare system. Next, we will need to provide implementation and fostering of data use in all the affected entities. And of course, next we will need to implement maintenance processes and scaling the system when demand will rise, and we will need additional persons to be working with this data. So we have several building blocks which are required to prepare such a solution. In e-health strategy, it will be leadership and governance, strategy investment, legislation policies, compliance, required workforce, infrastructure, standards, services, applications, and other. All these components will define digital maturity of the country, and based on this data we can develop digital health strategy. Also, we will include national health priorities in the strategy to cover the highest services with the highest demand on the national level. Next, we will develop investment roadmap, enterprise architecture, and this will involve governance mechanisms and national inventory of digital assets to be developed. After these activities, we will have a group of applications working with healthcare, so we will be able to proceed to data management and scaling processes and maintenance. If we look closer on an example of implementation plan, there will be several chapters. Chapter 1 will cover our team who will be involved in this digital healthcare system development, all the stakeholders in healthcare authorities, medical organizations, patients associations, and other stakeholders. Of course, we need to name beneficiaries from these activities. In general, it will be patients, healthcare professionals, maybe entities in government. In the second chapter, we need to name our priorities, and commonly it will be covering increase of health level, decrease in some kind of diseases, and maybe it will be savings in costs for the healthcare system in general. Next, there will be program context, pain points, health system challenges, current state workflows, and other. Next will be digital context. It will cover digital interventions, maturity readiness, future state workflows, digital inventory, functional requirements, and based on this, we will develop architecture covering current and future state of the architecture, standards, and how we will implement the standards. It's also important. Points of service applications, shared servers, services, and other. And next we need to describe implementation costs and in which phases these costs will be divided. How do we plan to cover these implementation expenses? How we will monitor this system running, and do we meet our indicators of efficiency of working of the system? Commonly, development of health information system pass several stages. On the first stage, we have monolithic architecture covering several goals, and it is possible to use this architecture only when we develop proof of concept solution, and we are not planning to develop this solution further. Next step is developing of integrated infrastructure covering several applications connected with each other with data exchange protocols, and providing different services in different applications. And the most sophisticated level of development is preparation of infrastructure able to process simultaneously working solutions from different sources, and they will need to work on the same standards, and it is so-called EcoStructure for health applications, and it is very easy to scale this system, and it's much more easier to update the system, to change some components, and such a system will cover much bigger amount of health sector goals, and it will be easier to support the system in general. When we need to decide which software solutions could we use, we will need to choose from several models. First of all, it's custom development of the software. When you hire some programmers to create a piece of software for your own purposes, and as a benefits we can name that you have a full control on this developing solution, and of course you will be owner of this technology, and you can engage your local IT companies in developing, so it's some kind of solution when you have resources for this development. Of course, you will have risks on this model. It will cover of course questions of budgeting and timing. You will need to truly believe in your team and their vision in infrastructure technologies they choose, and in many situations these technological issues could be inadequate. And there will be a question of long-term support, because you will always depend on a group of individuals providing this solution for you. Next model is commercial solution off the shelf, when you just purchase a ready-made solution for some process. Commonly, implementation of such a solution is much shorter than development of your own system. Another benefit is that you can assess this solution before you will pay for it. So because it's already developed and it's ready for you to be demonstrated. The product is maintained and updated by the developer, and of course you will need to pay for this. Commonly, this product was already tested and implemented in other organizations or countries. Risk of this model is expensive. It's commonly expensive solution with complex fee structures based on infrastructure which was used, for example, per server or per processor. And of course, it's common when off-the-shelf software is not designed for your personal needs, and you will need to change your process to address the process which was implemented in this software. Next model will be free packaged software. There are a lot of examples of how this technology is being implemented. Commonly, this is ready-for-use software, and you don't need to pay anything for its implementation. But on the risk side, you will have to take care about support, bug fixing, and by your own. And in general, the state of this software solution depend on goodwill of persons who develop this product, first of all. And in many situations, implementation and running costs are just hidden, and it's not totally free. You just will get information about your future payments only when you already implemented this software. Another example is open source software. It's a product created by community, and it is in general supported by this community. You can engage your local IT industry in implementation of these software products, and you can make changes in this product, so you can combine open source software with custom development, and maybe it is one of the most time and cost efficient way when you will take open source and develop it to the level of your requirements. Of course, there could be risks with support of this product, and it's not always provides required relationships, and in some cases running costs could be hidden also. And the last model is software as a service, and this technology could be very useful for companies or organizations without their own infrastructure, when you just subscribe for a service and run all the processes on the servers of the vendor, and it's very easy to implement such a solution, and costs are commonly clear for this, and required investments for development of such a solution could be shared between different customers of this software product. But hosting of the medical data on the servers in foreign or maybe some commercial companies' servers isn't always possible due to restrictions from national policies when data must be kept on the servers inside the country or maybe even on the servers of medical organizations. And there could be a problem with regular payments of the fees required for such a service provision. Of course, as a result of implementation of any software product, we will have data streams, and these streams are being kept in the cycle when we have demand for some kind of data, and it should be quality data, complex numerical forms, tables, graphs, and other. And this data isn't always understandable, and we need to convert it in interpretation, provide an interpretation for this data, so all the involved parties will get their required insights based on this information. Next, we'll be able to focus some of our activities based on this data, and next we'll be able to implement required changes in the system. And the process of reviewing and adoption of changes are always in place. We need to assess what was done, what are the results, what need to be changed, what policies should be implemented. We always need to assess current and future state and check if we are going the right way. Now let's take a look on an example of state healthcare information system which was implemented in Russian Federation, and it was done in several steps covering I guess more than 10 years for now, and the concept of the system was created in the 2011, and currently major parts of it were implemented, but not all functionality is in place. There were at first required standards and legislation developed. It was implemented in roadmaps of the implementation. Next, there were solutions for data exchange as an experiment, which resulted in development of the whole unified state information system in the field of healthcare. This system ensuring functionality and electronic services provided in healthcare. There is a portal for patients, and there are workplaces for healthcare professionals. This system maintaining medical records in electronic form, including electronic prescriptions. This system provides the use of telemedical technologies in the process of providing healthcare services. This system functions in several components covering separated functions, and providing support for the healthcare system in general. Also, there are security issues, which were already described in regulations, requirements for medical system and pharmaceutical organizations, how this solution will be implemented, requirements for the system itself, for data exchange, and all the related issues. Also, in regulations, electronic medical records are covered, and document management system was also developed to store medical documents in the unified format. Also, different approval processes for electronic forms was implemented and described in regulations, and this resulted in electronic workflow. So the system was able to reduce number of paper-based documents and to pass to the electronic forms. In regulations, there are rules for remote interactions between doctors and patients, and regulations how medical workers and patients could be identified, and requirements for document storage and exchange. All this was required to provide telemedical technologies. Also, in regulations, interactions between other systems and healthcare system were described, and requirements for a portal on which the services are being provided to the general public developed. To implement this system, there were several steps. Of course, they were covering IT infrastructure, software development, and integration with generalized systems in electronic government. As we see on this timescale, preparation of the legislations, regulations, standards, infrastructure cover more than half of the past 10 years, and only starting 2015, project for introduction of the system was begun. So preparation stages are very difficult and complicated in this area. If we will check the details of implementation roadmap, it was covering equipment of workplaces of medical workers with computer equipment, connecting medical organizations and their structural subdivisions to the secure data exchange network, connecting medical organization and their structural subdivisions to the internet network, implementation of medical information systems in medical organizations that meet the requirements of the healthcare authority, implementation of regional medical information systems, creation of the central archive for medical images of the subjects, connection of the laboratory and radiological information systems to the medical system, implementation of regional telemedical consultation system, and introduction of dispatching system for ambulances and connecting ambulance stations to the general healthcare automation system. This automation cover all subjects in the country, and regional medical information system provide also similar functionality as a centralized system, but covering only one territory. These regional components are central medical imaging archive, patient workflow, patient flow management, doctor scheduling, electronic prescriptions, integration of medical records from region to the general system in healthcare, telemedicine system, ambulance dispatching, and others. In medical organizations, there are also a lot of solutions which were implemented, and these implementations cover more than 70,000 subjects, and it is a document repository, automation of the workplaces of doctors, so it is full medical information systems which were implemented. Let's take a look at the tasks which were provided by this system after it was implemented. It's decision and resources management in healthcare in general. It's measurement of the development in healthcare system. Of course, it's support of the provision of the citizens with medical services. It's keeping of the required federal registries. For example, it could be registries of patients from different nosologies. There are also requirements for required databases in this area, which must be kept in digital form. This system gathers all the information about persons receiving medical care, and this data is available for analysis and exchange between medical organizations. The system stores information about persons who participate in provision of medical services. So it's a registry of medical workers also. In this system, we have a consolidated register of licenses for the medical organizations who are able to provide medical services in the country. And this system keeps all the maintenance of reference information for related lists, dictionaries, vocabularies, and all other. This system provides the function of healthcare services provision in digital form by itself. This system works with questions related to the insurance and provision of medical care with this financial side of reimbursement and coverage of medical insurance. This system facilitate consultations which are provided via the telemedicine technologies. As a component, there is monitoring and control for medical products procurement in the system to reduce the prices which are being taken from medical organizations for drugs. Another task of the system is organization of the statistical observations and gathering statistically significant data to optimize the healthcare provision. This system allows to present all the information in the single system, so it's a single point of truth for medical information in healthcare. And it organizes interactions with patients on different matters. Let's take a look what are the subsystems of this unified health information systems. It is a federal registry for reference information in the field of healthcare. It's a collection of different vocabularies. It's a federal register of medical workers, federal register of medical organizations, geoinformation subsystem information, and analytical subsystems to provide monitoring in medical products procurement, subsystem for automation of the collection of information related to healthcare, and provide reporting based on this information. It's Federal Electronic Registry and Federal Integrated Electronic Medical Records, which contain medical data related to the patients. Not all the data could be stored in the structured format, and some of the medical documents must be provided intact as a documents, and we have Federal Register of Electronic Medical Documents, so it is possible. Also, there is subsystem for maintaining specialized registries of patients for certain nosologies and categories of citizens, monitoring the organization of the provision of high-tech medical care for these groups of patients. There is subsystem of depersonalization of personal data, so it will be able to be used in scientific projects. There is secure data network and data integration subsystems. Let's take a closer look on these components. There is a Federal Register for regulatory and reference information system in the field of healthcare providers. This system provides standardization and unification of regulatory and reference information. There is all the required classifiers on and all the required dictionaries. For example, it could be lists of medical services, of laboratory assessments, and all the related dictionaries. In the register of medical organizations, we will see resources, list of medical organizations with their resources available, departments, equipment, beds, staffing, and all the related issues covering the area of medical services which could be provided with this exact medical organization. The geoinformation subsystem provides graphical display of healthcare resources located on the map, and this is very useful when you need to allocate medical help for distant areas of the country, and you can assess which medical organizations are close to exact small country town or village, and to designate where citizens of this small settlement should receive medical help from. In Federal Register of Medical Workers, we will have information with detailed data on staffing, their education, specialization, and all the related issues. Federal Integrated Electronic Medical Record is a collection of information about persons receiving medical care, as well as about persons in respect of whom medical examinations and medical tests were carried out. And this database could help to provide data for registries covering individual nosologies, for example, to assess number of patients which require specialized medical help, and to address this support more directly. Subsystem of depersonalization of personal data provides information about persons in a depersonalized way, so it could be used for scientific assessment. In Federal Register of Medical Documents, there will be electronic documents, and they are stored in medical organizations, and they could be exchanged between different healthcare entities to provide the required help more directly. Federal Electronic Registry will provide appointments with doctors in medical organizations, provide registration to preventive medical examinations, contains scheduling for patients, planning for consultations using telemedical technologies, provide required reporting, and assess citizens to health care service through the single portal of public services. In the subsystem for maintaining the specialized registers for patients of different specialized nosologies, there will be information about patients who will need additional support, specialized support, and this registry will, for example, cover register of person infected with human immunodeficiency virus, persons with tuberculosis, persons suffering chronic progressive rare diseases, orphan disease. It will be other types of conditions which require additional medical support. Information and analytical subsystem for monitoring and control in the field of procurement of medical products will provide information about process of planning and procurement of medicines, the results of executed contracts for medical product supply, provision of information on referential prices for medicines, for medical use products, as well as interactions with federal state information system for monitoring of movement of medicines for medical use products, and this integration could cover from end to end, from manufacturing of the medical product to the patient, and the system enable control of the prices for the medical help which is being provided. Subsystem for automated collection on information of healthcare indicators provide automatic collection of data from subsystems to the unified system and other information systems, collecting data about statistics for medical services which were provided, and this cover a very vast area of activities. Now let's take a look on architecture of state medical information system. Main functional blocks of the systems are unified reference information, health resources management system, collection, processing, storage, and exchange of medical data, telemedicine subsystem, electronic services for citizens. This system include register of unified classifiers, and there are more than 700 of dictionaries covering international dictionaries, local language vocabularies, reference books, medical references, non-medical terms, auxiliary dictionaries, and other classifiers. Resource management system will be capable to integrate geo information system and accounting for the administrative and economic activities from medical organizations, so it will integrate all the data regarding placement of healthcare resources and demand on these resources, and provide insights how this placement could be adjusted to meet all the healthcare system needs in current state. Now let's take a look on examples how federal registers look like. First, we'll take a look on Federal Register of Medical Organizations. It's possible to access this register with unified government services access interface. It provides list of medical organizations with detailed data structure, its location, building, structure unit, staffing, medical equipment, connected households, licenses. There could be different locations for different divisions of medical organization. All these buildings are kept in the system, and all the structural units are described in all detail. So all this data could be analyzed, and you can check if this medical organization have some specific type of medical equipment to provide necessary level of medical help. And in some cases, there are local households providing medical help in distant areas, and they are also kept in the system. So this information on the map will look like the numbers of medical organizations spread on the territory, and you can see the density of population in this specific country, and eventually where the biggest number of the population is located, the bigger number of medical organizations are situated also. Now let's take a look on Federal Register of Medical Workers, and there are quite similar interface providing detailed data entry on each specialist's personal data, of course, and it will consist of education, address, awards, and maybe some additional employee information, its education, its level of education, employment data, when and in which medical organization this exact medical worker was employed. And all this data is integrated in healthcare provision system, and it's part of the general digital healthcare solution. These registries are integrated in the system as well as nosology registers for patients, registers of medical documents, electronic health records, and other. Now let's take a look on telemedical system, a subsystem of the integrated medical information system. Federal telemedicine system consists of several levels, and it cover uh, it also integrate data from central archive of medical images, subsystem of electronic schedules for specialists, video conference system, uh, recording recording subsystem, translation of knowledge, and integrated electronic medical card. Only keeping all this data in hand, doctor will be able to provide medical help on distance, and it's quite necessary for doctor to identify this patient and get the same information on this patient if he will be visiting him in the medical office. So it should be the same level of information about this patient. Doesn't matter did this visit occur distantly or in person. And there could be different levels of telemedical services. For example, it could be consiliums when one doctor needs consultation from another doctor, or it could be interactions between medical professionals on other matters, or it could be interactions between healthcare professionals and patients. It could be remote monitoring of healthcare, and all these interactions are being described in telemedicine systems. As examples, we can list some implementations for this technology. Of course, many of them are related to the Internet of Things in healthcare, and it could be used in sleep monitoring and analysis, collection of sport training parameters, biochemical analysis of blood, urine, feces, control of cardiovascular system, mobile devices for ultrasound, mobile X-ray machines, cardio monitoring, and others. So if we enable these technologies for the patients, we need to be ready to trust in the data provided with these technical solutions, and it could be done only if we will present the required legislation and information system which gather all this data. Of course, medical workers must be provided with all necessary premises to provide these consultations and to use this equipment. And it was presented on the legal level, first of all, and in this system, first of all, we need to identify patient and medical professional, so we will be sure that this service is legal to be provided. In some cases, these services could be provided on the paid basis, so paid medical services are also possible to provide in telemedicine, and in some other cases, it's possible to provide anonymous consulting on the certain level of detailed consultation when doctor didn't have all the required information on the patient. This services provision is being licensed and controlled as is all the other medical services in countries, so licensing questions are always on the table. To use these features, medical organizations need to register in the required system to get all the required accounts and access. After implementation of digital healthcare systems, there will be a lot of data gathered, and we will have access for so-called big data to analyze and to provide medical decision support and scientific research and education. So it's not the end of implementation of these solutions, it's just the beginning of the new ecosystem. And of course, management will require additional statistics from these activities, and management process begin with formation of an information support system, which includes first of all an objective assessment of the quality and safety of medical care and an analysis of the factors that negatively or positively affect their level. So we need data to analyze, to know, does our system develop in the required way, and do we need to adjust something in this system. So it's basic requirements of the management. If we do not have required data, it's impossible to manage the situation. In paper-based world, there is unified forms for medical documentation, and there are over 250 different forms were developed previously, and they cover a lot of activities, and there is a lot of troubles during providing these forms. And these paper-based forms were transferred in 38 statistical observations, being totally automated with data gathering from information systems, and this allowed to cover primary accounting documentations for medical records during which were gathered during patient condition monitoring, treatment processes, diagnostic appointments, and it's needed to ensure continuity and interconnection between separate stages of medical care, and this part of information is being provided in the accounting documents, and the third part of documents are descriptions of work performed by medical staff. So it is in general what happened with the patient, what are the related records in the systems, and what were the actions of medical workers. The statistic information, this statistic information was sent recently to specialized portal in the statistics authority, and it was done covering lots of forms, and there is a long list of these forms, and automation of this process just itself saved a lot of resources, as on level of medical organizations, as well as on level of regional healthcare system and on the federal level. So it is not required to manually arrange all the data in these forms to provide all the statistics to the healthcare authorities. This process was automated, and data is being processed without additional resources needed. And this data gathering is connected with all the registries which we were discussing previously, and combination of statistical data of current situation in healthcare system with our prognosis for demand on the services could provide us useful insights. Do we have correct data in these registries, and do we have correct statistics, and were our estimations correct also? So we have a lot of data to analyze. The process of analytics of all this vast amount of data is selection of statistical materials which will be analyzed, systematization of this data, determination of methodology for calculation, visualization of this information, comparison with previously data, and with standards and planning values, and formulation of conclusions, forecasts, and assumptions. So it's a lot of work there. And the question of statistical analysis is a quite complicated area, and it should be covered separately because there is a lot of different difficult questions there. So for today it's all. Thank you very much for attention, and see you next time. Bye.